There's a story about a man who's walking down the street, and all of a sudden he falls into this big hole, and he can't believe what's happened to him, and it shocks him, and it takes him a little while, but he eventually gets himself back out of the hole and continues walking. And the next day, he is walking down that same street, and he falls back into the hole, and he thinks to himself, I can't believe I did this again. But he gets out of there a little bit faster. He's had the practice of yesterday to know. And he tells himself, I'm going to be more careful next time. And the next time he's walking down that street, he falls into the same hole. And this time he's down there and he's like, oh, I can't believe it. I can't believe I'm back here. I know exactly how to get out of this place, but I can't believe I went in again. So the next day, he's walking down the same exact street and he sees the hole and he thinks, not today. And he walks around it and continues on his way. But the next day, the man walks down a different street. Trauma recovery takes a lot of times, often, of falling down in that hole and finding yourself in a familiar place, understanding how to get back out of it. And sometimes it takes a couple of times of falling before you decide that you don't want to be in there anymore. This is a very normal part of trauma recovery. And I know it can be really difficult to see somebody going through that process, but the most helpful thing that we can do for somebody who is on their own journey, figuring out how to get out of that hole, literally, is to help them name and identify the most common symptoms that they'll likely experience as part of the recovery process. Now, today, I'm going to help you identify 3 of those symptoms, and then we'll take an in depth look at one symptom that affects most people who've experienced trauma. So, we'll cover the first 3 very briefly, but please know that each week you'll learn a little bit more about them. And then I'll give you one exercise at the end of today's video that will help you help someone else alleviate that symptom. So first of all, I know that it might sound kind of strange that I'm telling you that the first thing I want you to think about doing is helping somebody to name a traumatic symptom. And this sounded strange to me too when I first learned about it. But here's why it's so important. Basically, if somebody is experiencing a traumatic symptom, so they've recently left a relationship, they've moved into the salon, and now they're having panic attacks, which is what we're going to talk about in a little bit. If they don't know that they're having a panic attack, what they do know is that sometimes and all of a sudden they'll get to a place where their heart starts beating really fast and their face is getting red and they can't stop thinking or remembering the same anxiety producing thought. And until that woman, that resident, knows that she's having a panic attack, she's going to think that she's crazy and she's going to think that she's alone in her experience. The second that she knows that that's a panic attack, she can identify that that is what she's experiencing, and she could also ask for help about it. She could come to you and she could say, I heard you talking about panic attacks the other day, and I think I had one. And then you can say, great, now we can talk about it. Now we can work through it, right? But until that time, she might not even know that she has something to tell you. For our population, they might not know that these terrible feelings that they have are part of trauma recovery. They might not know to attribute their experience of panic, of restlessness, of irritability, of trouble sleeping to their past history. And we can help them do that. Once you realize that something is a symptom, you also realize that recovery from that symptom is really possible. So when we help someone name a symptom, we're giving them power to understand that they are experiencing the result of trauma, the result of something that happened to them. And we're also creating that hope that it's possible to recover from that symptom or to live without experiencing it. So, the first symptom that I'm going to tell you about today is something called hyperarousal. And I'm sure that you've seen this in action before. A person who's experiencing hyperarousal does not believe that she's safe yet. So, what she's doing is that she's perfectly on guard. She's ready. She's waiting for danger. She's looking over her shoulder. Her heartbeat's probably a little fast. Her breathing's probably a little bit shallow. And she's waiting for danger to return. Some of us have talked about this before as a fight or flight response. Some of us have used this metaphor that when you're in that state of hyperarousal, think about it like if you see a bear in the woods, you would be scared. You might run. You might have that feeling of your heartbeat racing. You might have this fight or flight response. But when you're in trauma recovery, you might think that that bear that you saw in the woods one day is actually under the dining room table, or it's sitting in the living room with you, or it's waiting for you. So you haven't understood yet that you've left that bear out in the woods. You think that you brought it with you. So somebody who is in hyperarousal truly believes that they're in danger. And the symptoms that she's showing, that hypervigilance, that keeping guard, that not letting herself relax, that not sleeping well, are perfectly great actions to take during battle. That's what she's ready for. She's not ready for long-term life yet. She's ready to survive a battle. So when you hear somebody getting irritable over a small thing, when you see somebody not being able to relax, when you see somebody looking over their shoulders, know that what you're actually seeing is somebody preparing for war and somebody who is very afraid. So I know that's easier said now than when somebody is, showing you a lot of irritability in the house, or you're trying to really make sense of that with a person. But part of our work is being able to help a woman see, and maybe this happens one-on-one with a care team, maybe this happens with a chart in the home that details these symptoms, but it starts by happening with you being able to recognize it, you being able to say, that woman is experiencing hyperarousal. That is a symptom of trauma, and that recovery from that symptom is possible, right? So if hyperarousal has a lot of outward qualities, right? Racing heart, irritability, running around looking for danger, the kind of opposite of that is the second symptom we'll talk about today, which is constriction. Now, constriction is really difficult because it could look like somebody is just kind of taking some quiet time to themselves, which of course we encourage, but it could start by looking like a woman who doesn't want to make decisions, who might not want to participate, but she kind of doesn't care what's happening to her. She might come to dinner, she might not, she might go to the movie, she might not, she will come to group, but she doesn't really care if she misses it. This kind of like chronic indecision is usually a sign of constriction, but it's not indecision. What happens when a resident is no longer willing to participate in decision making, to participate in the things that might matter to us, to matter to her, is that she's re-experiencing a time in her life where she gave up on herself. She's re-experiencing a time when she feels that she let violence happen to her. And because she feels like she gave up on herself that one time, she's replaying this again and again and again by giving up on herself in the present tense. So this woman, and again, I'll work with you on different resources we have to work with these symptoms, but it starts with you recognizing that if a woman is not making any decisions, doesn't seem to be engaged, doesn't seem like it matters to her what happens to her, it means that she's experiencing that giving up on herself again and again and again. So for this woman, starting to make small decisions is going to be really important. And that could be, where she wants to sit at the dinner table. It could be really small stakes things. It could be you giving her an option of, do you want to walk with me? Do you want to do this? Small stakes all the time, so she could build up that habit again of really engaging in her life. Constriction is the most quiet symptom, so sometimes it takes the longest to recognize. It's different from hyperarousal, which people wear on their sleeves. They're showing it to you all the time. Constriction is much quieter, but it doesn't make it any less lethal if we leave it untreated. The third symptom that I'll talk to you about today is called intrusion. Um, Intrusion is when a memory or feeling from the past seems to pop up into the present and trigger a woman to remember a time when she was frightened, to remember a time of trauma, to remember a time of danger. The thing about intrusion is that it could be triggered by sights or sounds or smells. So it's not necessarily obvious the connection between an intrusive memory and what you see happening in the present. But if there's maybe a song that played, you know, that a woman has a memory or association with, a negative association with, and it comes on the radio, she might experience that intrusive symptom, that attack of memory. And when that happens, the thing to remember is that she thinks that that danger is happening right now. She thinks that she's involved in it. She thinks that it's right in front of her. When a woman is experiencing an intrusive memory, it's like she's in front of us, but not really there all the way. This woman is going to need some help getting grounded in the present. And again, we'll go through some exercises today. But the first thing that you can do is to help her know this is a symptom of trauma. Memories like that, memories that feel like they come and grab you, is a symptom of trauma, and we know how to help you. The more we talk about it, the more language we give, the more empowered our residents become, the more they understand that this is not something that is going wrong in their brain. It's nothing they've done wrong. They're not crazy. They're not alone. They're simply in a program of recovery for trauma, and these are common things that we see along the way. So a quick review, and you'll get a worksheet that details these three symptoms, is 1, hyperarousal, 2, constriction, and 3, intrusion. So learning those words, becoming familiar with them, and again, check out this week's workshop for a quick and simple definition of each, will help you help a resident start this healing process and really become empowered. Now, one symptom that a resident might experience all three of those symptoms. She might experience one, she might really present with one, kind of get through that, present with a different one later, come back to the first one. There's nothing linear about trauma recovery, and there's nothing wrong with experiencing one, getting through it, and going back. Like that story that I told you earlier. Sometimes trauma recovery involves going back to the same place and trying to start over, and that's completely fine. One thing that happens to a lot of women, and maybe you identify with this too, and we see particularly early on in the recovery process, is something called a panic attack. And this is common, most common with women who are experiencing hyperarousal or intrusion. It's less common with people who are experiencing constriction because, again, they are very shut down. They present very quietly, and a panic attack is rather loud. So what a panic attack is a sudden attack that's very debilitating of anxiety. And just like those intrusive memories I told you about, it doesn't always make sense to us what triggered it, but it sure makes sense to the person feeling it. Anxiety can be really irrational. It can be really helpful, actually, sometimes if we have a test to study for, or if we have a presentation to do and our brain is telling us, let's focus, let's do this. But anxiety, when we worry about things we can't control, when we're trying to correct the past by just remembering it, is not fruitful to us. It can be really debilitating. What a panic attack feels like is literally like your breath is taken from you, like your heart is racing, your face turns red. Some people shake during them. It's often confused for a heart attack, but what it actually is this over response to anxiety. Now, in my time meeting the residents at the salon, I heard that this is something that our residents either have experienced in the past or are experiencing now. So it's in the house, it's very common, and the great thing is that It's both, we have tools to respond to it, and it could also be preventable. Once you start practicing those tools, panic attacks can lessen in frequency. So, while a panic attack's definition is a sudden onset of anxiety, what it also indicates is that it's like having a feeling that's stuck or repressed, and it's in your chest and it's in your body, and you're not talking about it, and you're not giving language to it, and you haven't shared it with anyone, and it's driving you crazy, and it's keeping you up at night, and you don't know what to do with it. So it comes out as panic. What we don't talk about, we act about. So if we're hiding a feeling, if we're holding something down, it often erupts in this kind of panic, which is our body's way of saying, there's something in here that we've got to get rid of. There's something in here that we can't live with right now. So a woman who's experiencing panic attacks would really benefit from some creative therapy, even some journaling, some free writing, anything that kind of takes her off guard and allows her to access whatever it is that she's repressing. She might not know what it is that she's repressing, to be honest. She might know exactly what it is, but she might have kept it from herself too. So creative outlets that encourage that kind of expression are going to be really helpful to her. But what will literally stop her panic attack is something that's called 4 square breathing. And this is what I'm going to teach you today. And this is where we'll end after today as well. So 4 square breathing is just that. It's a breathing exercise. But if we teach a resident this in a moment when she's not having a panic attack, right, because we can't learn when we're experiencing that. If we teach a resident this and get her into a regular practice of 4 square breathing, and she's able to do it during a panic attack, it will actually stop her symptoms from happening. But again, that means that we have to be engaging her in this practice in a moment of non-crisis. So I'm going to teach it to you today, and you go out there and you teach it to anybody who will listen to you. Teach it and do breathing exercises with them. Please practice it with yourself. Breathing like this improves our circulation. It helps our heart rate variability. It helps us remain calmer. It helps get toxins out of the body. It will stop a panic attack, but it can do so much more. So here's how we start. You should put your hands on your belly, and when you take a deep breath in, you should feel your stomach pushing your hands out. And when you let that deep breath out, you should feel your stomach going away from your hands and towards your spine. So let's just try a few of those together. So deep breath in and deep breath out. You want to try a couple of these until you get into your own comfortable rhythm of them. It's just a couple breaths in and out. And in and out. When you're comfortable, you can start the 4 square counting. So what that is that we inhale for 4 breaths, we hold for 4 breaths, we exhale for 4 breaths, and we rest for 4 breaths. And that repeated in a cycle, is the thing that actually arrests the panic attack. So here we go. I'm going to count with you. I'm going to do it 3 times, but know that you can do it until your panic attack stops, and encourage a resident. There's sort of no right or wrong amount of times to do this. If you're breathing and any thoughts come up in your head, totally normal. You can kind of imagine seeing that thought appear and letting it go. You can name it if you want. If a thought comes up of like, that's fear talking, that's shame talking, that is aggravation talking, that's restlessness talking, that's fine too. Or you can kind of just like let them go and watch them pass. So hands on your stomach, and we're gonna take a deep breath in, and 1, 2, 3, 4. Rest. 2, 3, 4, and out. 2, 3, 4. Rest. 2, 3, 4. Again, in. 2, 3, 4. Hold. 2, 3, 4. Out. 2, 3, 4. Rest. 2, 3, 4. In. 2, 3, 4. Hold. 2, 3, 4. Out. 2, 3, 4. Rest. 2, 3, 4. So again, cycles of that will actually stop a panic attack or be the foundation for a great deep breathing process. Again, today we reviewed 3 very common symptoms of trauma, and we also talked about panic attacks and why identifying them is the gateway to empowering our residents to heal and recover and let them know that recovery is possible. By naming a symptom, you're letting somebody know that they're not alone in what they're feeling. Thank you so much for your time today. Be sure to check out our worksheet, and I'll see you next week.